Hi, my name's Joan Cotta, and I'm a PACT leader at Cambrian Park United Methodist Church here in San Jose. I'm also a single parent and a senior manager at a high-tech company here in town. I have great health insurance through Kaiser and my employer, and I can use it whenever I want. But there is a problem. Like many companies in the Valley, my company drops your kids when they're 23 or 24 off your family plan, and they no longer can get coverage for them. I have 2 adult kids who fell in that hole. My daughters are twins, and when they aged out of my plan, I had to scurry around and try to find some kind of medical coverage for them. And when the insurance companies I talked to, I was really afraid that they would find some reason to deny their coverage, even if it was a minor condition. I mean, they've lived more than 20 years, so there must be something wrong with them. That's always a real fear for a parent, that whatever you do, your kids aren't going to be covered and something's going to happen. I did find them coverage, but one I had to pay for. Neither of them had full-time employment for a number of years. One was a student and the other worked a number of part-time jobs that afforded no coverage. As a single mom, I was paying for my own health care share, plus my deductibles, plus my daughter's private health insurance, and it was running about $400 a month back then. That was a few years ago. And I know costs have significantly gone up since that time. Lucky for me, one of my daughters went on to get a full-time job, thank you San Jose State, with a Valley company that provides health coverage. For a time, my other daughter also found full-time employment and got medical benefits and insurance. But, like many of us, she was laid off and lost her job and her health coverage. So I stepped in again to go back and buy private insurance to give her coverage during the time when she was unemployed. The problem remains that good insurance is tied to your employment. And in our jobs, when at a time where we have over 11% unemployment here right in Silicon Valley, and layoffs are happening all the time. Those that get laid off are our kids too. It's not just our older adult workers who've been doing this for a long time. So our kids lose their coverage again, and they're back in the hole. I know countless parents could tell this story. I actually talked to 2 others here while I was waiting who had the same story as I did, about our 20-something children with no health insurance. My question is, at what point in the future will I not be paying for my adult children's health insurance? Thank you.